Martha Stewart has always been a figure of admiration for her timeless elegance and vibrant energy, even as she navigates the later stages of her life. In a candid conversation, she firmly dispels the persistent whispers and assumptions surrounding her appearance, emphasizing her commitment to transparency and authenticity. She asserts with unwavering confidence that she has never undergone any form of invasive plastic surgery purely for aesthetic enhancement. This declaration comes from someone who prides herself on being straightforward and truthful, questioning why her word alone isn't sufficient to put these rumors to rest. It's a reflection of her frustration with how society often scrutinizes public figures, especially women, for signs of artificial youthfulness, refusing to accept natural aging or personal care routines as explanations. Delving deeper into her experiences, Martha recounts a specific incident that led her to seek medical intervention from a plastic surgeon, but she is quick to clarify that this was not a voluntary cosmetic choice. It was an unfortunate accident that occurred during a severe weather event, highlighting how everyday moments can turn chaotic. She describes leaning down in her dimly lit kitchen to bid farewell to her beloved pets, a routine gesture of affection. In that moment, she startled one of her French bulldogs, causing the animal to react abruptly. The dog didn't intend harm, but the sudden movement resulted in a painful collision where Martha's lip was forcefully pressed against her tooth, creating a deep laceration that extended from her lip nearly to her nose. The injury was severe, leading to profuse bleeding that covered the dog and created a distressing scene late at night amid a blizzard. This mishap forced her to miss a scheduled appearance, something she notes as a rare occurrence in her busy life. The urgency of the situation in such inclement weather added to the ordeal, but she managed to get to a hospital where medical professionals attended to her. They performed a procedure involving numerous stitches to close the wound, which she estimates at around 16. While a plastic surgeon was involved due to the facial nature of the injury, Martha insists this was purely reconstructive work aimed at repairing the damage and preventing scarring or functional issues. She views it as a necessary medical fix rather than an elective beauty enhancement, pointing out how well she healed afterward. The scar is virtually invisible now, a testament to the skill involved, but she maintains that labeling this as plastic surgery misrepresents the reality of what happened. It's an example of how terms like plastic surgery are often broadly applied, blurring the lines between essential repairs and cosmetic alterations. Beyond this isolated event, Martha opens up about her approach to maintaining her skin and overall look without resorting to surgical options. She acknowledges experimenting with various non-invasive treatments that are popular in the beauty industry, such as injectables and skin resurfacing techniques. For instance, she has tried Botox, but with mixed results. She describes how placements in certain areas of her face, particularly the forehead, can lead to an unnatural arching of her eyebrows, creating a surprised or artificial expression that she finds unappealing. This honesty reveals her selective use of these procedures, opting only for what enhances her natural features without distorting them. Similarly, she has explored fillers to address volume loss, lasers for skin texture improvement, and other tightening methods that promote collagen production and firmness. Focusing on specific body areas, Martha mentions treatments targeted at her chest and décolletage, regions that often show signs of aging due to sun exposure and natural skin changes over time. These procedures help in smoothing out wrinkles and improving skin tone, contributing to her confident demeanor. However, she emphasizes that her primary secrets to a youthful appearance lie in lifestyle choices rather than clinical interventions. A balanced, nutritious diet plays a crucial role, filled with fresh ingredients, vegetables, and wholesome foods that nourish the body from within. She combines this with a dedicated exercise regimen, incorporating activities that build strength, flexibility, and endurance. Whether it's yoga, walking, or more vigorous workouts, consistency is key in her routine. Martha's perspective on aging is refreshingly pragmatic. She admits to not dwelling excessively on the concept of age, viewing it as just a number rather than a defining factor. Yet, she expresses a desire not to appear as old as her years might suggest, which motivates her self-care practices. This mindset challenges societal expectations that often pressure individuals to either embrace aging without intervention or pursue extreme measures. By sharing her story, she encourages others to prioritize health and well-being over chasing unattainable ideals of perfection. Her journey illustrates that true beauty stems from self-acceptance, informed choices, and a holistic approach to life. Expanding on the accident's impact, one can imagine the immediate aftermath: the shock of the injury, the challenge of seeking help in a storm, and the relief upon receiving proper care. Such events remind us of life's unpredictability and the importance of resilience. Martha's ability to heal so effectively speaks to her overall health, likely bolstered by her nutritious habits and active lifestyle. It's a narrative that humanizes her, showing that even icons face mishaps and vulnerabilities. In discussing non-invasive options, it's worth noting how these treatments have evolved, offering safer alternatives to surgery. Botox, for example, works by temporarily relaxing muscles to reduce wrinkles, but as Martha points out, improper application can lead to undesirable effects. Fillers, often made from hyaluronic acid, restore lost volume, while lasers stimulate skin renewal. Her experiences provide valuable insights for anyone considering similar paths, stressing the need for skilled practitioners and realistic expectations.